I saw this article a couple weeks ago, and I didn't cover it because it just wasn't the type of news that I was covering at the time. However, I couldn't pass it up because somebody has to start standing up for these children, for goodness sakes. The doctors aren't doing it. The pharmaceutical companies, they just want to find anything to shove down anybody's throat. And then, of course, the parents just don't know better. They're trying to do the best job that they can and give their kids the best shot at life. And in this article and in this research, it's talking about more kids with borderline behaviors are being diagnosed with ADHD. New research reveals problems associated with diagnosing challenging but normal behaviors as ADHD. Now, this is alarming. Okay, so what they're saying is that these kids aren't challenged cognitively, but they're just harder kids to deal with. They just have more challenging behavior styles, and then they're just throwing them on a ADHD medication along with a diagnosis. So that's what we'll uncover, and then we'll also talk about natural solutions to helping a child who has some ADHD. But before we get started, I'm Dr. Nick Zarowski, and welcome to the channel. Be sure to subscribe, hit that notification bell. And you got to hit that notification bell because YouTube's not going to tell you when my videos come out. They pulled one down just a week ago. And so hit that notification bell, and also be sure to check out www.drzee.tv for all my natural health videos and stay up to date with the current health news at drzee.tv. Now, let's dive into this. So the article starts with the writer talking about their daughter just having some challenging times at school, being a little bit more of a challenging child. And they say in here, maybe a diagnosis could be a straightforward fix to the problem. Now, look, folks, I don't believe that just putting a diagnosis on somebody, a label on somebody, is ever a fix to any problem. For instance, I'll have adults come in and they'll say, yep, my doctor, they diagnosed me with fibromyalgia. I hurt all the time, I ache all the time, they said I have fibromyalgia. Okay, that's good. What did they recommend that you do about this? Well, they didn't recommend anything. Okay, but what kind of treatment path did they set forward for you? Well, they didn't give me any treatment path. Oh, okay, so they just labeled it for you. Yeah, that's what they did. Well, okay, that's all fine and dandy. It's nice that you have this label, but what are you going to do about it? We care about solutions, not putting a name on things. And this is what happens a lot of times with I would say adults and children in the world of healthcare. So we have to make sure that, just labeling, we understand that just labeling our child with ADHD is not a solution. So what's the problem? Increasing awareness of ADHD has led to a consistent rise in the number of children diagnosed and treated for it. This would be good if it meant we were getting better at finding, diagnosing, and helping children impaired by inattention or hyperactivity. Now, this is important to look at this concept too. The idea of the medical field saying, well, the reason that we have more children with ADHD is because we're better at diagnosing it. No, that's not the reason. It's like them saying, well, the reason that we have so much type 2 diabetes is because we're better at diagnosing it. No, all you needed was a scale, a set of eyeballs to see that somebody was overweight, and a simple blood sugar meter, which has been available for a long time to determine that somebody has type 2 diabetes. It's not anything to do with us being better at diagnosing it. Well, the same thing goes with ADHD. Now, the article goes on to say, however, newly published studies in JAMA Network find that the increases in ADHD diagnoses may be largely due to children like my daughter, whose behaviors fall within a normal but frustrating range. Okay, I see this all the time. I have this patient who was taking their child in, and basically the child's being treated for ADHD, and it was so sad to see because good kid, young boy, look, challenging. There's no doubt about it. A challenging kid, but yet they were diagnosed with ADHD. And you know what the doctor said after they put him on the medication? They told the doctor told the mother, you shouldn't expect much out of him. Holy smokes. I mean, if you told me that about my son, I'd come unhinged. Yeah, here's your son. You shouldn't ever expect anything out of him. Wow, that's a heck of a thing to say to a parent. And once again, the parents don't know any better. They're just trying to do the best that they can. So, I conducted this research with colleagues at the University of Sydney and Bonn University, and the study concluded these children are unlikely to benefit from being labeled with ADHD, and in fact, they might be harmed for it. Okay, so this is really alarming stuff. Now, in this article, they talk about ADHD. What it is a persistent pattern of inattention and or hyperactivity, impulsivity, and it interferes with functioning or development, okay? It's one of the most common childhood disorders affecting 5 to 7% of children. Over the past decade, debate on appropriateness of the diagnosis has grown in line with the rate of diagnoses, okay? So what they did here is they reviewed the results of more than 300 studies on ADHD over the past 40 years to determine which children are being newly diagnosed and if they benefit. The study design allowed us to summarize a huge variety of studies in the way that was never done before. Here's what they found. Okay, now this is kind of the important part of this whole thing. They found that since 1980, increasing numbers of school-aged children and adolescents around the world have been diagnosed with ADHD and medicated for it. We know that ADHD-related behaviors exist on the spectrum with no or minimal hyperactivity or inattention on one end and severe ADHD on the other. Now, many children get distracted easily, they're forgetful, and they find it difficult to sit still or wait their turn. In most children, these behaviors are mild enough to not interfere with normal life. Okay, you have to understand there is a certain level of being a child, especially being a boy. I have 3 young boys, and guess what boys like to do? They like to be physical, they like to be active, and sitting in school, sometimes staring at a book and listening to the English teacher, that just isn't a whole lot of fun. So we have to realize that there's a certain level of being a child within these children, and we can't expect them to be perfect. Another huge issue that I see, and I work with an enormous amount of teachers that are patients of mine, and one of the things that there's no doubt that they see is that there's a lack of discipline in the home, okay? And when these kids go to school, they have no discipline. So, of course, if they have no discipline in the home, how are they going to act in school? The other major issue is that when they're at home, they are on electronics, constantly playing video games. And think about this for a minute. If these children are on electronics and things are blowing up and they're shooting things and driving a car and all this activity coming at them so quickly, if you think about the brain and how it performs in order to play a video game, how do you think the brain performs while sitting in a classroom listening to the Charlie Brown English teacher? It's not very good, because that's two very different modes of operation, and the brain has a hard time going from one place to the next. And so this is another major issue, is kids playing electronics for hours and hours on end, and their brain operating in one mode and then expected to go to school and operate at a totally different frequency. It's not a good thing. Now, in the United States, for example, almost half of all children diagnosed with ADHD have mild symptoms, with around 15% presenting with severe problems, and only 1% of all children in an Italian study had severe ADHD-related behaviors. And in general, children today are no more hyperactive or inattentive than 20 years ago, okay? So basically what they're saying, in reality, okay, and I'm not saying here that ADHD doesn't exist, but what I am saying, in reality, around 15% present with severe problems, okay? That's probably the real number of kids with actual ADHD. And in Italy, only 1% of the children. So all this has led us to conclude a substantial proportion of these children who wouldn't have been diagnosed 20 years ago are, in fact, at best, borderline cases. For example, one study showed, while diagnoses increased more than 5-fold over 10 years in Sweden, there was no increase in clinical ADHD symptoms over the same time. This means that with the lowering of the diagnostic bar, children diagnosed with ADHD are, on average, less impaired and more similar to those without an ADHD diagnosis. Okay, so what they're saying is they lower the bar, and all of a sudden, so many more kids have ADHD, okay? And I'm very critical and skeptical of this because we've seen the medical system do this before. They did it with cholesterol medication, right? You know, overnight, they have changed the numbers in history. They have changed the numbers on the bar for what is deemed necessary as a number to be put on cholesterol medication. They changed the number. They lowered the number overnight, and all of a sudden, by the flip of that switch, you had millions more people who needed cholesterol medication. So what if they're doing this to children, and then all of a sudden, all these children need medication because they're too hyperactive, right? And they're literally putting these kids on medication, and they're literally stealing the life from them because they just can't function mentally. And the danger of putting these children on brain-altering drugs is very, very scary. So these are all things we have to think about. Make sure you share this article with people that you may know that have children who are a little bit more hyperactive, who may have a little bit more of a struggle. Because when I see this, I literally go, okay, what could we do with this child to make them healthier, to make their brain function better, right? What could we do to change their lifestyle? Maybe it's taking them off of the video games and having them focus on playing board games and things that actually change the way that their brain is working to fit what is necessary for school. Change the way that their brain's functioning so that they can actually focus better in school. Because when you're playing a video game and it's just chaos, the brain's chaos. And chaos doesn't work good in English class. Now, the other thing that we can look at is, well, if the child's hyperactive, what can we do in order to help calm them down a little bit, right? Well, there's a couple things that we can look to. And right, as an adult, we see these things and we go, oh, well, I'm going to change my diet. I'm going to do this. I know what I need to do, right? I know that these foods don't make me feel good, but for some reason, we think that children are garbage disposals and we can feed them whatever they want and the product is going to come out good. Go to an average restaurant and what you're going to find is that, there's chicken and salad and stuff on the adult menu, and you pull up the kids menu and you got macaroni, pizza, fried chicken tenders, and some other garbage, applesauce or something like that that's got corn syrup in it, right? The food is horrible that most kids are eating. So how can a brain function without proper foods? The other thing is sugar. We know as adults that if we have a lot of sugar, then throughout the day our brain crashes and we get brain fog and we get just overall cognitive dysfunction if we're eating high sugar foods and sugary drinks. Well, what about the children? They go home at night and they suck down, a couple cans of soda. And then they're expected to perform the next day. So first of all, we have to be very critical of what these kids are eating. They need to be on diets that support brain health, give the proper nutrients to the brain. It's very important for kids to have a lot of fat in their diet because their brains are growing so rapidly. Neurologically, there's so much happening. You take a child who literally has no experience in the world and every bit of input their brain is taking in and literally developing so that the child can one day be a functioning adult, right? As an adult, you don't go outside and go, oh, that wind on my skin, what is that? Or that grass, that feeling of grass on my feet, what is that, right? A child is taking all that in. So we have to make sure we're giving these kids the proper nutrition. And along the way, it's good for kids to have proper physical activity. Sitting on video games is not proper physical activity. They need to be out running around playing. They need to do the things that are natural for kids to do. And then the other thing that we can do too is we can give them proper nutrition through vitamins. Okay, are the kids taking multivitamins? Are they taking their fish oil? There was a child that was playing on my daughter's soccer team. And I was frustrated to see this because the poor kid couldn't focus at all. The coach would say something and then the coach knew that he wasn't paying attention. So then the coach would call him out and say, what did I just say? And the kid would just basically I have no clue what you just said. And so the coach would be hard on him, but I was like, the kid has the inability to concentrate. And so with kids that are really hyperactive, you can use a simple mineral called magnesium, and you can really help calm them down quite a bit. There's one called NeuroCalm, which is a magnesium that we'll use clinically in order to help kids just calm down a little bit, or adults calm down a little bit. And it really just is calming across not only the nervous system, but the musculoskeletal system as well. Now, the other thing that we'll do is, look, if the kid doesn't have proper brain nutrition, the brain can't function. Using Larger amounts of DHA can be beneficial, and fish oil, and all these really healthy fats that the brain needs to function right. I'll put some resources down in the description. So these are the things that you can do in order to make sure that you set your kid up for success. But remember, diagnosing and labeling the child, but not putting the effort in on the back end, it's not going to do any good. Some people would say that this diagnosis, I actually looked in the comments, and most people are saying this is a nonsense diagnosis. They shouldn't be labeling kids with this. And we're seeing right here that it's overused, the diagnostic bar is too low, and it's becoming an excuse for maybe parents or teachers or any adults who don't want to deal with children who are just a little bit more difficult, and also an excuse for not making sure that your child is living a lifestyle, a proper lifestyle that fits in line with what human beings need. Check out some of the other videos on this channel and put your thoughts down in the comments below.